So I'll start by like a brief background. It's like following the introduction of the Connecting Care Act of 2019, OHTs were introduced as an innovative model that focused on enhancing collaborations between different provider organizations in the continuum of care in different population groups. And this was to ensure like better connectivity of care that is for individuals and communities. And like most integrated care systems around the world, OHTs have progressively implemented key enablers like collaborative governance models, leveraging digital health in order to enhance interorganizational communications or interprofessional team-based care that will also improve coordination of care across organizational boundaries. So as effective integrated care systems that at maturity will be physically and clinically responsible for the health of their populations. So systems leaders have explicitly expressed strong commitments to enhancing equity in all aspects of the organization and delivery of care across Ontario health teams. This fundamentally means a transformation in the healthcare system towards a model that consistently considers social justice and fairness in all aspects of care. So this is why this presentation would try to revisit some of the main tenets of equity and what it means for Ontario health teams. These are all terms that we are very used to in terms of like our regular healthcare system, this like the healthcare, health equity, and health inequities. So the broad definition of health would actually can be considered like the Ottawa Charter of Health Promotions really states that health is the state of complete physical, spiritual, mental, emotional, environmental, social, cultural, economic wellness of the individual, family, and the community. And health is also considered as a major resource in terms of how people can be productive members of the society and also communities in terms of managing their independence and progressing towards achieving their own specific goals. And healthcare now covers all of those aspects of health services that are really needed in order to establish these connections, like the collaborative governance, and also allocating resources according to the different needs that is necessary for the whole system to actually function effectively. So when we talk about health equity, this is much more like some sort of a normative terms that really focuses on understanding how people, like every individual within the population, has an equal opportunity to achieve their full health potential. This is extremely important because several studies have shown that within the general population, although healthcare has really improved over the last few decades, however, there are still certain groups that have poor outcomes in terms of care, poor access to the healthcare system, and also are treated differently, some sort of like discriminations that actually occur across the healthcare system. And why do this actually happen? It's just because like we have some sort of like health inequities, and these inequities are like systemic, unfair, and avoidable differences in the health of various social groups. Why are they systemic? Is because there is a consistent pattern of differences in health between people that actually have a higher, like a higher level in the social hierarchy as compared to those that are in a lower level in the social hierarchy. And then why is it unfair? It's because from a social justice and from a fairness perspective, we kind of see that there is this consistent difference, and it is also avoidable because these differences are the result of uneven distribution of resources, power, and opportunities within our societies. This means that if we decide to do something, we can actually improve or reduce the disparities between people of different social groups. One other key concept is social class. So this social class now refers to like different groups that's due to the differentials in the distribution of power, privilege, and prestige across societies. We have these different groups across the social hierarchy that have much more opportunities to achieve better health than other groups that have less opportunities to achieve this better health. And how do we identify these different social groups? Generally, we look through the social determinants of health, which are the conditions in which people are born, they grow, they work, they live, and they age, and that's actually have some influence on their health. So if we are actually thinking on looking at the healthcare system, these social determinants of health as identified by one of the the conferences here at York University. They actually identify 16 different social determinants of health, which are displayed on both sides of the image that we have down there. So referring to this image, we see about, let's say, 3 different people trying to watch a baseball game. And if the baseball game is actually like attaining your health, these men, their main difference is like in height. If we take disability, like a social determinant here, so the person with the taller person has no physical disabilities, for example, and the shorter person probably has maybe some physical disability. And if we are looking in terms of equity, we see that in order to improve the healthcare of the shorter person, we will need to find different ways of organizing the resources within our healthcare system in order to help, in order to distribute them according to the need of different groups instead of doing a flat distribution equally across the different groups. So what has been done in terms of the Ontario context? Next slide. We have Ontario Health has produced guidance documents like the Equity, Inclusion, Diversity, Anti-Racism Framework in 2020 that has assisted several, that lays about 11 different strategies that you can use in order to advance health equity. And we have 4 core strategies: collecting equity data, embedding equity in the strategic plan, partnering with other organizations in order to advance indigenous health, or then they have about 7 different peripheral activities that can be used to advance some health equity. We know for sure that some organizations, for example, when we examine the Greater Hamilton Health Network Health Equity Framework, they constantly referred to the Ontario Health Equity anti-racism framework. So we would also like to hear, what are your experiences? How did you use this particular framework in your reflections and the activities that you developed to advance equity in your Ontario health teams? What does this mean now for Ontario health teams? We can actually look into particular areas, that is promoting Ontario health teams would definitely need to promote equity in health and healthcare in all aspects of their interventions. That is incorporating an equity lens in the organization and delivery of health services, and considerations of socially disadvantaged groups in the organization and delivery of services. So developing these interventions to reduce disparities and also between the disadvantaged and advantaged groups is going to be like a key process between for the Ontario health teams. And also Ontario health teams will also need to focus on how to monitor the progress in equity in the health and healthcare. That is like the ongoing assessment of patterns of health inequalities, focusing on those that are most likely to be unfair and avoidable in order to inform their practices and also to guide the development of policies that will also help to improve this, reduce these inequities. And part of my work, I come up towards understanding the equity measurement strategy. That is when like the evaluation strategy of the different Ontario health teams. How do they put the special considerations in assessing the disparities between the different social groups, and also incorporating it in the regular evaluation and monitoring of the healthcare system? Equity measurement strategy now just emerges like, it's what is it, and how do Ontario health teams how can they learn from it? So these measurement strategies would be like multiple activities that's coming together. They aim to improve the assessment of these health inequities in across this population. And for example, we can actually see this equipment measurement strategy as being part of the broader evaluation strategy. Entire health teams are required to have this collaborative quality improvement plans, the CQIP, that they develop. So in integrating an equity lens in the CQIP might also be some aspects of like having a coherent equity measurement strategy. Or also they can have like separate discrete activities. For example, carrying out an anti-Black racism survey that also complements the broader equity measurement strategy. So our studies show that we have about 5 different components that are needed for an effective equity measurement strategy. The first component of an effective equity measurement strategy is having that capacity to identify the social groups of concerns within the population. That is, there are just so many vulnerable or disadvantaged social groups within your population. So do you actually measure all of these at the same time, or do you have some sort of way of prioritizing those that are much more relevant to your local context? That would mean that you need to engage with different social actors in order to identify what's like what are the groups within my population that are most at risk, and those that we need to urgently actually look into how the disparities between them and the other populations can actually be addressed. And also identifying the indicators of interest, because at the end of the day, when you're talking of monitoring health equity, you're actually looking at the disparities between the different social groups, and what you're going to be looking at are like how these different performance indicators in their populations, how they like do some sort of disaggregated analysis across like the different social groups to see the social gradients between those from a higher social those from higher social group and those that are actually at the lower part of the social system. So you will need to look at health indicators for the health status, indicators that actually examine the major determinants of health, for example, like healthcare utilization, and other healthcare indicators like how the costs distributions, the resource allocations, and the utilization of different resources are distributed within the population. Then the last 3, next slide, aspects of an equity measurement strategy is identifying the appropriate data source for good information, because one of the most difficult challenges of the equity measurement strategy is really having that consistent good data that will permit you to analyze to capture these differences within the population. And this data generally comes in from surveys. You can actually have like patient experience surveys, provider experience surveys, organizational assessment surveys, or household surveys. And some studies actually use census data that's collected at a national level in order to carry out this analysis. Then administrative and clinical data also need to be collected appropriately. Then after that, you need to describe the different patterns of health inequalities. This you can actually do some sort of like segmentation and some stratified summaries that would identify like different groups or subgroups within your population that share the same characteristics, or also some sophisticated statistic approaches that will help you to analyze the way or like describe different patterns of disparities within your population. And then at the end, you also need to have a practical impact on, okay, now we understand these different disparities, what next? So you need to consider what are the implications of these disparities within, like, at the policy or practice level, and also to develop some sort of plan that will help to address or to redress these different inequalities. So thank you.